The Veterans Community Park and Pavilion is visualized as a place where the community and combat veterans can learn a little bit more about each other.
This would be a place where veterans and their families would have an opportunity to avail themselves of various services, including a lot of services for veterans that the city promotes, but also have exhibition space, park space, so that the public at large would come to this park and pavilion, would interact with veterans, recognizing the nature of warfare, recognizing what the culture does when it goes to war, recognizing what the culture does to its warriors and their families. This is all part of community mental health.
In this country right now, and have had really for 40 or 50 years, a profound divide between the general civilian population and our military. When I think now that we have young men and women who are coming out of the service after as many as 5 back-to-back combat tours in Iraq and Afghanistan, that is very serious business. We see daily the difficulties that these young men and women sometimes have in coming back and just taking up a civilian lifestyle.
The goal here would be to create a public-private partnership to raise money to build the park and pavilion and to have a significant academic input so that we could measure different programs that exist at the park and pavilion and determine their effectiveness.
I myself am a Vietnam veteran. My job was as a rifle company exec and company commander in Vietnam back in the very early stages of the conflict. We were the 2nd Battalion ashore at Chu Lai, and I was in action for 12 months straight. What'd you do over there? Well, I never know how to answer that question. The truthful answer is that I killed a lot of people. Even at that remove, killing somebody is a profoundly unnatural thing for a decent human being to do. If you look at military training, all of it in one way or another is aimed at stifling that instinct not to kill and somehow or other putting you in a frame of mind to kill.
I don't consider the emotional turmoil that some veterans of war are in when they return from combat, I don't believe that should be classified as an illness. I think it is an expected and natural reaction to the stressors and strains of combat.
The term post-traumatic stress syndrome, I think, is greatly overworked. I would call it a perfectly natural response to being in combat.
This bridge is a perfect spot, and it certainly could be incorporated into the Veterans Community Park and Pavilion. It sits atop Waller Creek at the north end of the medical center. It sits across MLK from the main campus, and it sits east of the museum district.
Well, I think we can learn a lot, yeah, from Greek classic literature. We can learn a lot about how to go about welcoming home these warriors that go off and fight for us.
The Park and Pavilion represents a new model of healthcare. It's a model that embraces community activity to promote health, not simply doctors, nurses, social workers, other healthcare providers treating illness, treating patients with illness, but rather creating community environments that promote health in many different ways. And my view is that when the veterans community and the civilian community are brought together, that will promote overall community health. It will promote the health of the veterans community, which is otherwise isolated and has to metabolize the after effects of combat alone, in isolation.
When I have found a sympathetic ear and I have that kind of feedback, I can't tell you what a comfort and a help it is to deal with these little demons that crop up. I can almost always find some connection between that and where I was back in 1965 and 1966. This pavilion, this place, this kind of a respite where veterans and community members can go and simply sit down with one another and talk. It's one of the most important things that would happen there. And just sit down in an easy chair next to a veteran and talk for 15 to 20, 30 minutes about that veteran's experiences in the combat zone. And we've got lots and lots of an increasing body of evidence that that is an extremely effective way of helping veterans get a bunch of stuff off their mind and kind of rehabilitate themselves to civilian life.